Hello, welcome back to Guff-Gaaf Unfiltered. I'm your host, Sudesh Gurung. Today's podcast is really important to you and your family because on my show today I have Dr. Nilesh Bhargav. He is a family medicine doctor. So we're going to talk about everything related to health, diseases, illness, and healthy lifestyle. Dr. Bhargav, welcome to my show.
Thanks, Sudesh. Thank you for having me.
It was my long time dream to bring someone from health professionals. Okay, because I listen to a lot of podcasts where the doctors are the guest. Because I feel like I get direct advices, about
Right.
health in
Yeah.
general. So it's good to have you here.
Absolutely. Always available to answer questions.
Okay, so family medicine doctor, right? If people don't know, and I don't know a lot, what is it like? What do you do?
So, family medicine, over the years, the scope has expanded immensely. Many people you talk to now, they'll be like, oh, family doctor, they just refer patients out, or they treat cold and, flu symptoms. Family medicine is more than that. For instance, a family medicine doctor can handle, multiple conditions. They don't just need to refer out. The only time they ever refer out is, for example, if they feel that this is not in their scope of practice and they require a higher level of care, they will refer out to a cardiologist, dermatologist, nephrologist. But for a lot of the common symptoms, we can actually take care of. I don't need to refer out a patient if they're worried about their blood pressure. I don't need to refer out a patient to a cardiologist because they've come in with chest pain, and obviously there's more to it. I mean, chest pain shouldn't be taken lightly, but it's based on my clinical assessment if I want to refer the patient out to the cardiologist or not. So your family doctor is essentially your first point of contact. Once you come to the family doctor, he then evaluates you, sees if he can treat you within the scope of practice, and if he can't, then he'll refer you out. But otherwise, this is the person you want to come meet, and if you have questions, you want to discuss things, this is your family doctor. The word has family in it.
And I've seen when I was visiting my family's family doctor. My family doctor, I was in one of the community health center, and I didn't go see him for 2 years, and they closed my file.
Oh, yes.
But I recently went to my family's family doctor, and like you said, they cover a variety of health related, like everything related to joint pain to like flu, right?
Right.
And then if there is something they need to refer, then they were referring to a specialist.
Absolutely, yeah. It's the scope. I mean, just to give you an idea, in the U.S. there are family medicine doctors who deliver babies. There's family medicine doctors who are working as sports medicine doctors. They work on the sideline. There's family medicine doctors who do some low risk surgeries. So, as I said, it's family medicine, but they're sort of jack of all trades. Yeah.
Yeah. And in my experience, what I used to think, or a lot of people used to tell me that in order to become a doctor, it'll take you like years, more 10 years. So is that true? Like, how long does it take to be doctor?
So yes, unfortunately, it is true. However, I went to a Caribbean school. Many of your viewers who are saying maybe familiar with Caribbean medical schools. They advertise these accelerated programs where within 6 years you can obtain an MD degree, then go on and start your career as a physician, or rather start residency and then your career as a physician. But yes, a typical medicine degree usually involves 4 years of undergrad, followed by 4 years of medical school, and then followed by residency, which can vary, depending on the specialty you choose. So yes, I would say in most cases it's about 10 years.
Okay.
Yeah.
Wow.
That's US and Canada though, So if you
Oh.
go India, Nepal, it's a little bit different.
Different, yeah.
Yeah.
My sister-in-law right now, she's studying undergrad, so she's also want to become a doctor in future, and we always joke around like it's gonna take you still 5, 10 more years. Is this different phase in every undergrad? Is different medical school? How is it different?
So I mean, undergrad you can pretty much take anything, right? You would want to take something which has a link towards medicine, for example, biochemistry, or pick subjects. Some people, have physiology in their undergrad. So once you do undergrad, then in, I guess, your last year, you apply for medical school. I went through a slightly different route, but typically that's how it is. You're an undergrad, you complete undergrad, you apply to medical school. Require you to take the MCATs. A lot of these Caribbean medical schools, there's some that don't require you to take MCATs. So then once you get into medical school, then it's 4 years. Your first and second year are your non-clinical years, meaning that's where you learn your anatomy, physiology, biochemistry, some other of the medical subjects. And then your third and fourth year is actually your clinical years, meaning that's when you're a medical student going into a hospital. You're learning how to take histories, you're learning how to do physical examinations. And you in those third and fourth years, when you go around and try to like learn every field. So for example, internal medicine, obstetrics, there's surgery, and then that's where you start seeing what you like. It's like, do I want to be a surgeon? So once you get to the fourth year of medical school, you can narrow down, because that's your elective year. Meaning that if you want more experience, you're like, hey, I want to become a surgeon. So I want to do more rotations in surgery just so I get more experience, I learn more. And so that's what fourth year becomes then. Your fourth year becomes where you're fine-tuning everything towards your goal.
Okay. And then residency is you're actually practicing it?
Yeah, so residency is the best way to describe it is that you're a doctor, but you're in a supervised setting. So for example, family medicine is a 3-year residency program. It's 3 years of residency training. In Canada, it's actually 2 years. In the US, it's 3 years. So first year is called intern year. You'll often hear this a lot if there's people out there who watch shows like Scrubs or Grey's Anatomy, you'll hear these terms, right? So intern year is said to be your hardest year because you have just graduated medical school and now you're at a hospital and you have a patient that you're responsible for. You are responsible, however, you have your 2 seniors above you, you have an attending there, but it's still, that's someone's life that you're handling and you're conveying that this is what I'm reporting, this is what the patient said to me, this is what I want to do for the patient. And so that's why they say residency training is immensely tough. I mean, I'm talking about 80-hour work weeks, right?
Yeah.
Sometimes you have to do 24-hour on calls where you're just in the hospital for 24 hours. At nighttime, if you're lucky, you sleep if there's nothing going on. But otherwise, if it's a busy night, you're up 24 hours. So intern year is, I would say, the hardest year. Your second year becomes a little bit better because you've figured out a few things. And by the third year, most residents, I would feel, are in a position where they're like, okay, I can see myself practicing out in the real world. And while you're in residency, you're always under supervision. There's always an attending that you report to. And so, you're a doctor, you're managing the patient, but you come back and you tell the attending that this is what I did. And the attending, who is the big doctor, the main doctor, he listens to you, and if he thinks everything is fine, he'll say, good job. Or if he'll be like, I would do this. So there's patient safety at all times.
Right.
Yeah.
And then once the residency ends, then you're a doctor now.
Correct. You're the doctor. You're the attending. You don't have to take sort of orders from other people. You're in charge of the patient. You're responsible for the patient.
Yeah.
And then yes, the pay bracket goes much higher.
Makes sense.
Yes.
With the duration of the education and all the practice, right, like 10 years, more than that, it requires a lot of patience, right? And you have to be really driven and passionate so that you can continue and then actually finish to become a doctor. What made you, become a doctor or choose this field? Is it typical like any South Asian families where you have to be doctor, engineer? Is it like that?
A little bit of both, yes. My father, he's a doctor, he's a GP. So growing up, obviously, going to his work and being around him, that was sort of there. For me, that's where I got my influence from, why I wanted to become a doctor. But another reason was that I loved meeting people.
Hmm.
I love interacting with people. And medicine was a great way for me to do that, but also help people. I think you brought up a great point that, medicine is such a long journey. You need the passion. You need um, to have that in you that I want to help people. A lot of people think that, oh, let's do medicine. I want to make so much money.
Money.
But how much are you investing into it, right? You come out with, insane amount of debts. Many people have different types of debts. So for me, it was mainly I was passionate. I enjoyed talking to people. I enjoyed taking care of people. And that's sort of what got me to family medicine as well. Family medicine is a lot of patient interaction, connecting with the patient, learning about the patient. And that's what made me choose family medicine.
Did you ever second thought, or how challenging was it like during all those years?
Yeah, there's a couple of people here who knows my entire sort of journey. In this part of the world, or rather, I should say, in my case, I was in the U.S. After you finish medical school, you have a degree. It says Doctor of Medicine on it. But if you don't get into a residency, you're not technically a doctor, right? You're not seeing patients. You can't see patients. You need a license to practice. And that's what residency, that's why many people finish medical school, and then you'll hear that, if there's people here who are, international medical graduates, they would know what I'm talking about. You finish medical school, you've done all the hard work, but you don't get into a residency program. And the way the residency program is structured, that you only apply once a year, and you have to wait almost 6-7 months to find out if you've matched. We call it the match.
Oh.
So essentially, think of it like in September, you've applied to residency programs. You get interviews. And then March, you find out if you've matched, if a residency program has accepted you. And if they haven't, then you start the cycle all over again in September.
Wow.
And what makes it even more challenging is that now you haven't matched an entire year, right? They haven't matched. They're going to ask you, what did you do for an entire year? So while we're in medical school, we're seeing patients, we're staying active. But once you're done medical school, what do we do?
Yeah.
Right? And so that's where for myself, I was one of those people who graduated medical school and had to wait a couple of years before I got into a residency program. That was the most challenging time for me. Medical school was tough, no doubt, yeah. Had my struggles there too. But, people just told me, like, just keep working hard. And I was like, great, I finished medical school. I haven't gotten a residency. Now what?
Yeah.
And I think that's what the most scary part for me was. I didn't know now what. What do I do? Because once you have a doctor of medicine, if you want to change your career line, usually pharmaceuticals is what people go to. There might be other things there, but it's still not medicine. As you said, it's a 10-year journey, right? I've devoted 10 years to this, and now you're saying that I can't become a doctor, I can't work. So those years after medical school, I would say, were the toughest for me. Very, very hard. I had fantastic support. I had family. I had friends. And, I was here in Ottawa, and I found cricket. Well, cricket was always part of me. I did lose it, but, it was just a great way to, again, meet people. I've met some amazing people here who shared their journeys, right? Everyone has their own journey. So I think you get motivation when you meet people like that.
For sure, for sure. You said your dad was also a doctor. What did you learn from him?
Hard work. He's practicing in the UAE. He's also a GP, which is similar to a family doctor.
Okay.
But I think it was just going to his clinics, seeing patients come to him. There's generations that come to him now.
Yeah.
Even now when I talk to my dad, he would tell me like, "Oh, I had a patient. Now his grandson comes to him."
Wow.
Right? So
Yeah.
that's if you think about it, it's beautiful. It's like I treated him. Now I'm treating his son, and now I'm treating his kids, his daughters. Like it's beautiful. You're treating their whole family, and it also shows the trust they have with you to bring their generations to you.
Yeah.
So I think seeing hard work, the trust people had in him, I think it was fantastic.
In my life, I lived in a refugee camp for my 16 years of my life.
Wow.
Yeah. So in refugee camp, the medication, like, there's no proper medical facilities, right? Very limited. Like we had a small health center with very limited capacity,
Wow.
and then only couple of doctors.
Wow.
Okay, so I remember like if I used to get sick, and then my family will take me to the clinic. There's a lot of line. Usually in flu season, there's a lot of kids there, and everyone will just get cetamol, the medication.
Yeah.
That's it, right? So I value the doctors. I value the medical facilities or medical services because it can change the life.
Right.
You know, how do you feel as a doctor? Like, is it like a normal thing where you're just doing your work, or do you feel different when you're helping people, making people better? You're seeing people coming ill and then get better and going home. How do you feel?
Yeah. It's I think residency teaches you a lot. As an intern, my first year, very low on experience. I'm worried about even the smallest of things, and then as you gain experience, you still worry, but you worry about smaller things, and that's because you gain experience. So that's the idea I'm going with. As I continue working, the years of experience I gain, the more comfortable I'll become with my job. But it is gratifying. A patient comes to me, they don't know what's going on. I ask the questions, and then I'm able to figure out how I can help the patient. And they'll come back to me after a month, and they'll be so grateful. They'll be like, "Thank you so much. I was suffering, or I was having this pain, and now I can do this." It's such a gratifying feeling, and they're so appreciative, right? And mind you, I spent 15 minutes with, or 10, 15 minutes with one patient. And so I treat the patient, I talk to them, I move on to the next patient. So it's not like I'm constantly thinking about that patient, but that patient, when he comes to the doctor, all he's thinking about is that interaction with the doctor. Right? So it's nice when they come back and you're like, "Thank you so much." Like it feels great. It feels great, like that I could make a difference in their life.
Yeah.
Yeah.
That's so true. And even, when we're going to the hospital and waiting for hours and hours, the nurse will come, and then, any question you ask to the nurse, they'll say, "Well, you have to ask for the doctor, or you have to wait for the doctor."
Right.
And doctor finally comes, and then, like you said, maybe with the limited time, we have like a couple of minutes with the doctor, and the doctor goes, right?
Yeah.
So even that 3 minutes is very valuable, right? Because you're giving your 100% of trust to the doctors, right?
Right.
So it was interesting to see how doctors feel.
It is. It's and so I'm a family medicine doctor.
Yeah.
We work in hospitals. We work in emergency departments. Me specifically, I'm going to be in the outpatient. So in the offices, when you go to a doctor, that'll be me. And so we generally have more time to talk to patients. Emergency department, I don't know if you've experienced the emergency department, wait times, doctors being sort of overworked, overburdened. So at times, the interaction in emergency department can sometimes be short. So that's where it varies sometimes in people's experience.
Yeah. And also, I feel like when the doctor comes and then, "What are your symptoms?" Blah, blah, blah. They're able to figure out within, minutes, Maybe it's all the learning and all those practices, So that's why you put a trust, and you actually believe what the doctors are saying. Like, okay, yeah, that's what I have,
Right.
Usually when we go to the family doctor's office, now in Canada, there has been a lot of barriers where you just have one issue. Like if you have 10 different things going on, you meet the family doctor, you just say one issue, that's it. Even when you go to the walk-in clinic, you say, "Okay, I have a headache." Okay, but I also have a stomach ache. That's a headache only.
Yeah. And that's very unfortunate. I think here in Canada, that's perhaps done to cut down on wait times, which, they're already pretty bad. From what I understand, you can wait weeks before you see your family doctor. It's very unfortunate. I think when I start practicing, I probably won't apply that rule. I know many doctors here do it. But they also do it to make sure that they're giving you adequate amount of time. So if you have come in, if you have 15 minutes for the visit, they want to make sure they're not missing something. So if you have 5 complaints, they'll ask you, "What are the 3 most worrisome complaints?" Or they'll listen to your complaints and be like, "Hey, I think let's address the chest pain. The finger pain can wait. I think the chest pain is could be more serious. Let's talk about a little bit more about that, and let me get you in, and we'll talk about your finger pain or whatever it is. So it's unfortunate over here, and I shouldn't just say over here. It happens perhaps in other parts of the world too.
Yeah.
But I think from a doctor's point of view, the reason why it's done is just so we can give you the attention for that one problem. If it's a quick problem, I think we can definitely address it. But if it's two major problems, we may require more time, which is why we say let's focus on one issue and then bring you in.
Oh, okay. So it's not you're rushing, you're trying to focus on something that's bigger.
Right. We want to be fair. If we start giving 30, 40 minutes to every single patient, how are we going to get to everyone, right? So, and I understand, patients always come and be like, well, the doc never heard me. I waited for him for 3 weeks and he didn't even address my problem. And so it's tough. Like, it's very tough. It's a balance that needs to be created. But it's hard. It's definitely hard.
Yeah. I'm thinking in a patient's point of view where if it is not severe, you can't go to emergency because you got to wait 12 hours and they'll say, well, it's not an emergency.
Right.
Go see your family doctor. And then walk-in clinic is very hard to get walk-in clinic now.
Right.
And then you go to family doctor finally. Sometimes you get appointment after a week and you're sick right now.
Yes.
So it is a tricky, especially in Canada right now.
Right.
And I've worked with a lot of newcomers where they don't know anything about Canadian healthcare system, and then they experience that and they kind of feel like, well, doctors, they don't care.
Yeah, no, it's absolutely. As you mentioned, many people come here, and especially places like India, Nepal, like the access to doctor. I mean, there's no referral, right? In places like India or Nepal, if you want to see the cardiologist, you go to the cardiologist. You don't go to the GP and then he sends you. Over here, it's different. So, it's tough. I think when new people come here, I think that's one area before coming you should understand because, health is unpredictable. And so it's always good to know what a country's healthcare system is like.
So, doctor, I have been seeing a lot of, especially South Asian, so I'm talking about Nepali community, a lot of seniors, even starting like 40 years old, are getting diabetes. I know how hard it is. Like what are the things that you have to monitor? Every single thing from the blood work from eyesight to weight management, everything, right?
Right.
So this is something that I haven't got, like, why so much Nepali people are getting diabetes?
I wouldn't just say it's Nepali. I think it's a lot of the South Asian population, and a lot has to do with lifestyle. A lot has to do with your diet, exercise. In India, when you eat food, they say something like "pet bhar ke khana," right? Which means eat till your stomach is full. And I wouldn't say that's an appropriate saying. Like, you shouldn't eat till your stomach is full because then you're eating a lot. So, the stuff we eat, we're not aware of what we're eating, how many calories it has. There's no awareness of that, right? And a lot also has to do with your work. If you are a labor worker, if you're working construction, you're working 15 hours a day, naturally your caloric requirements are much higher, but you're just eating. But then you could also be a cashier working for 15 hours, and you're like, after 15 hours, I want to eat as much food as I can because I'm hungry. I've worked 15 hours, but your caloric requirement is actually low because you're not physically active. And so, things like rice, chapati, roti, like, aloo ki sabji, like these things are high caloric things. And it's always okay to have in moderation. But I think not knowing what is a lot, your stomach shouldn't be the one telling you that you've had enough. You should mentally know what you're eating, how much of it you're eating, right? Naturally, many people eat for other reasons too. It could be stress related. Life throws many things at you. So that changes your stress levels, it changes your routine. So diet is a big factor in why, many young people are becoming or perhaps getting diagnosed with diabetes. The other thing is lifestyle. With social media the way it is now, the accessibility of just scrolling through Instagram, seeing video after video, people aren't going outside and aren't becoming active. You got to stay active. You know, if you're not active and you're eating, that's going to put, you know, you're working towards diabetes then. So exercise, diet, perhaps the two big reasons. If you're not around the right people, if you're just around people who want to just go eat, or, you know, they just want to go drink, then that's all you're going to be doing,
Yeah.
right? Like look at yourself. You actually have a great lifestyle. You play soccer, you play cricket. I've seen you host karaoke, or you sing.
Yeah.
You know, that's so great for mental health, right? If your mental health is not good, that's going to put you in a state where you don't feel like doing anything, so you sit home, and then you overeat at times, right? And then your relationship with food also needs to be good. I'm not saying that you have diabetes because you overate. Like, your relationship with food needs to be great, right?
Right.
If you're bored, there's other things to do. Many people, when they're bored, they go eat, right?
Yeah.
So it's things like that.
So direct relationship between eating and diabetes. What causes diabetes? Are we all diabetic? Like, is there a point where is it over? Then we get diagnosis? What causes it?
So we as physicians look at something called hemoglobin A1C. If that hemoglobin A1C is above 6.5, that meets the criteria for diabetes, right? So that's what we track as physicians. There are some people who have diabetes, and there's a genetic component to it. But there's type 1 diabetes and type 2 diabetes. Type 2 diabetes is all the reasons I've mentioned. It's based on your lifestyle. Type 1 diabetes is autoimmune, meaning there can be a genetic component to it, but it's also not from lifestyle related reasons. Yeah.
Okay. I started learning about lifestyle and all the diseases, the relationship between that, once I started listening to podcasts.
Yeah.
Okay. Before that, I thought there's no relationship. Like, you just eat. And like you said, Nepali people, this is how we eat. This is a thal. This is rice. And then there's small sabji, some curries and
Right.
pickles. But rice is the main ingredient.
Right.
And when you are like going as a guest, that's something you get often, like, okay, more rice, more
Yes,
rice.
yes.
And you have to eat rice.
Of course.
And sometimes we feel like, okay, and parents will say, well, I'm not eating rice. I would rather eat roti, or I'll rather eat pasta.
Right.
And if you're not educated, it all falls in the same component.
Right.
Then there's protein, there's carbs and stuff like that.
Right.
So we're not educated, right? Like, we just feel like whatever we're eating is healthy.
Of course.
Yeah. So what are some of the food that we have to limit?
Again, nowadays, if you open up Instagram, you just Google, recipes, they'll all show up for you, right? In moderation, everything is okay, right? It's just in excess. So if you're having one roti, fantastic. If you're having, just like a half a cup of rice or 1 cup of rice, that's okay. It's when we go overboard, right? Now, many people are like, well, how do I know? Like, how do I know too much is too much, right? And this is, even myself, this is much later that I realized how much calories things that I eat have. I would be, for example, I drove here. In most days, I would drive back, stop at Tim Hortons, get a double-double, get a snack. But just a double-double and a snack, I'm at 500 calories. Most people don't require, I would say, more than 2,000 calories a day. There's a formula to it, but if you calculate your BMR, basic metabolic rate, what that means is that if you were at home and did nothing, that's the amount of calories that will be burnt. So they call that your maintenance calories. Look at how many calories. If you look at Tim Hortons actually has a nutrition list where whatever you order, it has calories next to it. A lot of these places have it. But look into that. Yeah.
So it's very important to pay attention to what you're eating,
Correct.
how much you're eating.
Yes.
So moderation is good.
Moderation, yeah. I think there's many ways to start. Many people are like, that's it. I'm going to do intermittent fasting. I'm not going to eat. But, and hey, for some people that might work. Some people are like that. They're like, I just need to go all out, and that's what works for me. But for many people, you need to start small. And the way you need to start is you need to, as you mentioned, educate yourself a little bit. So if I am eating rice, how many calories does it have? It's called calorie counting. It's something which I've also started doing.
Yeah.
But you start counting what you're eating, and you realize, wow, this is how much, like 2,500 I'll probably reach by the end of the afternoon, the way like we eat sometimes.
Yeah. Okay. So can we avoid a lot of like illnesses if we eat right and then do some exercise?
Yes, let's talk about the more common problems, right? Blood pressure, diabetes, cholesterol. All these things can be easily managed with lifestyle modifications. Now, everyone's a little bit different, right? But all these things, if you go to any doctor, they'll say, watch what you eat and exercise.
Yeah, sometimes people get offended, right? Like you go to see doctor and they're like, "Are you drinking enough water? Are you exercising? Are you sleeping well? Are you eating well?"
Right.
Focus on those things, and then you get sent home, right? And people like, "But that's it," you know. So you're saying that is a main thing.
It is. I mean, yes, medications, again, like many people think that it's a doctor's job to put you on medication or a doctor didn't prescribe me medication. But no, like for my patients, I will only put you on medication if I feel that you benefit from it, right? And even if I have you on, say, a cholesterol medication, diabetes medication, every single visit, I'm going to ask you, what are you eating? And how much exercise are you getting? How are you sleeping? Are you stressed? All these things matter a lot. You know, medications help, but you also need to, again, we're coming back to that word, lifestyle modification. You have to do that.
For weight management, that was called Ozempic, and now it's everywhere. Like every social media or actors, you know, or influencers, they are talking about Ozempic, and we see ads everywhere now
Yeah.
about Ozempic. What is it? What is Ozempic?
Yeah, it's definitely been in the news, eh? So Zempic is a drug that was initially started for diabetes. And the way it was helping with diabetes is, yes, it was controlling the blood sugar, but it was also making you lose weight by suppressing your appetite. So patients had dramatic weight losses. They were losing weight, which is fantastic. And then they slowly started prescribing that to people who were obese and brought their weight down. Ozempic for me now, and there's Ozempic, there's Wegovy, there's Mounjaro, which is again very similar to the way it works.
Oh,
All these medications have great potential, right? But it doesn't mean everyone needs to be on it. Ozempic is great for someone who is obese. By obese, I mean having a BMI of greater than 30. Even though BMI is, it's not the best tool to assess, obesity, but they say BMI greater than 30, you're obese. So for me, prescribing Ozempic, I usually prescribe it to someone who has a pretty high BMI and, who, because of their weight, they can't exercise much. It's difficult for them to move. And so what Ozempic does is it brings their weight down to a point where they can move. And all of a sudden, now their weight's down, they feel better, they can move, they start exercising. They mentally feel better. So then they're like, hey, I think I can control my diet because Ozempic is already suppressing my appetite. I can definitely do this. And so, they work together really well. What most people don't know about Ozempic and Wegovy and Mounjaro is that once you stop the medication, if you haven't made changes to your lifestyle, so if you haven't started eating properly, if you haven't started exercising, that weight's going to go back up.
oh,
Right. Because the effect of the medication is to suppress your appetite.
yeah.
Right. And if you haven't made those changes and you're like, I'm just going to eat, I've lost weight, I'm going to go back to my old habits, your weight's going back up. So, that's very important for people to realize. It is a chronic medication, essentially, if you're not going to be making those lifestyle modifications. And not to mention, they do have side effects too, right? If people Google Ozempic and Mounjaro mostly Ozempic is coming in the news, but, when you Google that, you will see some side effects. You will see, some people saying that, oh, I took Ozempic and this happened, it kind of ruined my life. So again, medicine is a lot about risk versus benefit. Only take the medication when needed and obviously talk to your physician about it.
Right. Talking about medication, I know a lot of people where they have a list of medication to eat. Some people, they take like 10 to 20 medications per day. As a doctor, is it important to focus on prevention than cure? And is there a problem now with over prescribing medications?
Definitely. I'm a family medicine doctor. One of my jobs is preventative medicine. When you come in, if I start to see that your blood pressure is creeping up, because if you come to me 10 times, we take a blood pressure reading each time. And if I see it going up, I'm going to be like, hey, your blood pressure is creeping up. I want you to start making those changes now. And then I tell the patient, I was like, if your blood pressure reaches a certain level, I think we'll need to start you on medication. And it's always a discussion with the patient, right? Rather than, it's easier to have a discussion rather than telling the patient, hey, here's a medication, take it. That comes across a little bit aggressive, right?
Yeah.
So as you mentioned, prevention is key, right? My job isn't to prescribe you medication. My job is to prescribe you medication if I think you will benefit from it. But otherwise, I don't want to prescribe you medication. My job, if I can do something without prescribing medication, that's fantastic. Pharmaceutical companies will always come up with drugs that will be beneficial to you, and that's up to me to figure out if you will benefit from it or not.
Let's say sometimes we get a little headache, or we get stomach ache, or we're feeling a little bit dizzy. Our normal thought would be, I take Advil, or take a Tylenol, it will feel better. Or you're hungover with my friends, like sometimes we're hungover, they'll be
Right.
like, I'll just take 2 Tylenol, it'll be better.
Right.
Is there a harm or benefit of just taking Tylenol, Advil with small aches?
No, I think these medications are over the counter. Obviously, anything in excess is bad for you. So always read the instructions. There will always be a limit to how much Tylenol or Advil or any other over-the-counter medication you can take in a day. But for small things, they work great. Like as you mentioned, headaches. It's such a common thing. People get headaches. In those cases, there's no harm to take Tylenol to resolve them. Now, what you should be concerned about is if you're getting headaches every day, and then the only way the headache is going away is with Tylenol. Now we have to figure out what's causing your headache. Is it too much screen time? Is it dehydration? Is it something more serious? Do we need to get imaging done? So, Tylenol, Advil, here and there, it's completely fine.
And what about there's a medication, and is it antiviruses?
Yes, so that's a good point you brought up. So, many a times people go to the doctor and you'll always hear, oh, this is likely a viral infection as opposed to a bacterial infection. In general, viral infections don't require antibiotics. Right?
Antibiotics, yeah.
Correct. So antibiotics are things like your amoxicillin, augmentin, there's clindamycin, there's this azithromycin. So these medications are meant for bacteria.
Okay.
There's different things we look at to identify if something is bacterial or not. Sometimes we have to do a culture, which is pretty much taking a swab. We take a cotton, we take a swab. So if you have a throat ache, we swab your throat. We send it off and we find out if it's bacterial or not. Just like, any other thing. So, that's where overprescribing happens. That's where drug resistance develops. So if you're overprescribing antibiotics, say if you have you come in, it's a viral infection, but the doctor still gives you an antibiotic, it's not really going to help you.
Yeah.
Many people think that, no, I do feel better. But in those cases, it's often that you have a super infection, meaning you have a virus, and because of the virus, you develop a bacterial infection. But in most cases, it's a viral infection that is causing your symptoms. Antibiotics in those cases won't help.
It doesn't work.
Correct.
I remember sometimes doctor will prescribe and they will say only take when necessary.
So a lot of the times what you see would happen is you come in and you're like, hey, like my throat's hurting, it's been 5 days. Doctor will probably say something like, it's likely viral. I'm prescribing you antibiotics just in case because, getting an appointment with me, you'll have to wait another 3 weeks. So I'm prescribing you the antibiotics. Only take it if your cough persists for, another 5 days, or you develop a fever, something along those lines.
I think a lot of female that I know in my circle are deficit of iron, omega-3, the vitamin Ds, and that's common with female than male. Physiologically different, that they have to take a lot of these supplements. Then, like, I have never taken any supplements, but they were really recommended.
Yeah. So yes, as you mentioned, physiologically, right? So Naturally, women have their periods. They have, a time every month where they have blood loss, and every woman's a little bit different. Some women have heavy flows, meaning they have a lot of blood loss, and they can become iron deficient from that. And then that's generally the case. Is where we see women who come in and they'll complain of being tired, and then we check their blood work and their iron is low, or rather their hemoglobin is a little bit low, and then we find out it's iron deficiency, and that's when they get prescribed iron pills. So yeah, it's generally physiologic. Obviously, it can also, for some people, be nutrition related. Sometimes it's also related to other diseases they may have.
And I know some people where they have 10 different supplements. Right? This is for iron, this is for omega-3, this is for
Right.
other thing, potassium, blah, blah, blah.
Right.
Is it necessary to take all of them, or are there supplements, or can we eat something that can actually help?
Right. So, as the name suggests, it's a supplement, right? So it's not a replacement, it's a supplement. I think there are many people that may go a bit overboard and they'll be having every single supplement possible. My best advice for you would be speak with a dietitian. I'm not a dietitian. I can tell you a little bit, but dietitians can perhaps go into greater detail in what types of food can perhaps provide you with all the essential vitamins that are needed. Because like if you can get it through your diet, why spend more money buying supplements and trying to get it through there? So biggest advice for me is, and that's where I'm family doctor. I don't know anything. This is outside my scope, and so I want to, I would say reach out to a dietitian or a nutritionist who can further expand on that. But yeah, I definitely shouldn't be taking 10 additional supplements. No.
Okay. Are there any benefits of fasting?
Depends, varies people to people. If you're diabetic, be extremely cautious when fasting, right? Because if you're not fasting, you're not eating, your sugars can actually go low. When you're diabetic, your sugars are high, but when you're not eating and you're taking a medication that's supposed to lower your sugars and you're not eating, your sugars are going to drop. And if you ask any doctor, they'll say that I rather have you a little bit high on the sugar rather than low. So, fasting has its benefits. You'll hear many people doing intermittent fasting. If you don't have any health conditions and you're starting it off, I think it's okay. But I think you need to be very cautious in how you do it. Always, if you do see a doctor and you're concerned about, I want to lose my weight, I'm thinking of doing intermittent fasting, just make your doctor aware, just so that they know that, okay, this is something he tried. Because if you come back 2 months later and be like, hey, I'm having XYZ symptoms, he can correlate to that. So yeah, I mean, fasting works for some people. For other people, it's not the best, right? Because if you're not fasting, you're not getting energy. And if your job is something that requires you to expend a lot of energy, it's probably not the best fit for you. For many people, it just puts them in a bad mood, right? We hear people, it's like, I'm just hangry, right? I'm just hungry. So it varies. I think there's a balance. I think, there's a very popular diet, I guess, nowadays in Bollywood. Oh, no, I wouldn't say Bollywood, but you hear it. It's called the OMAD, 1 meal a day diet. So, I think it's a little bit extreme. It works for some people, but to me, a diet should be sustainable. So, is this something you see yourself doing for the rest of your life? Is it something you want to do now till you get to a certain weight? So, for me, I was like, if you're doing a diet, I would do it so that it's sustainable, something that I could do for the rest of my life.
Yeah, so it's not like a quick fix.
Right.
Yeah, so
Right.
it depends on every individual. Because
Correct.
in Instagram or TikTok, you go like, you type fasting, everyone will be, fasting is the key. Yeah, it is like
Right.
Cure for everything,
Yeah.
It really depends, because sometimes people can fast and then at the end they overeat, like you said.
Yeah, absolutely. I mean, Ramzan is a great example. You ask many Muslims during Ramzan, it's a day where they're supposed to be fasting, but there are many Muslims who gain weight during Ramzan, right? And it's because they fasted the whole day, and now, when they break the fast, they eat. You have to be very cautious, and again, everyone's a little bit different.
What about blood pressure? Because I know a lot of people in my family or friend circle where blood pressure is the issue and they have to take medication. Even one time in my experience where the blood pressure was low, and then we talked to the doctor, and doctor was like, low is good, drink more water, high is pretty bad. And we're like, what is blood pressure and how does it affect us, and
Right.
what's high, what's low?
So blood pressures tell us a little bit about what's going on with your arteries. So are your arteries loose? Are they tight? Is there tension? And so blood pressure is affected by, again, sort of the same lifestyle habits that you develop. So if you eat a diet that's high in salt, so sodium, if you're smoking, if you're drinking alcohol, if you're not exercising, all of this can affect your blood pressure and send it high. Yes, low blood pressure, I would say, depending on the age of the individual, we prefer it more than high. Because when you have high blood pressure, it can lead to stress on the heart. And then that can lead to heart attacks, it can lead to strokes, it can lead to many other things. So, yes, we don't want it too high. When your blood pressure is low, when it becomes too low, that's when you start feeling lightheaded, and it's likely because you're dehydrated. So if you're playing a lot of sports and it's hot and you're not drinking water but you're running around and then all of a sudden like you're becoming lightheaded, it's likely because you're dehydrated.
It's better to have lower.
Right, there's a range. So the classic is 120 over 80. They say that's perfect blood pressure. That's where you want to be. So if you're as close to that, as close you are to that is the best. You don't want to be above 140 systolic, which is the upper number,
Yeah.
and you don't want to be greater than, I would say, 80, 90 on the diastolic, which is the lower number.
Okay.
Yeah.
Okay. What are some of the illness that we have to go see the doctor? Sometimes we may not go. I see that a lot of men will be like, okay, yeah, I'm having pain or I'm sick, but it's okay, it will go away. I don't have to see the doctor in initial phase. Are there any symptoms that we actually have to go see the doctor?
So, another point actually on blood pressure. So, blood pressure, elevated blood pressure, we call hypertension.
Yeah.
Right? Hypertension also is called the silent killer because many people have elevated blood pressure, but they just don't know why, because no symptoms. They don't have any symptoms. They don't know their blood pressure is high, and then one day they develop a stroke, they develop a heart attack, and you find out in the emergency department his blood pressure was incredibly high. In men, or rather, it shouldn't just be men or women. It's everyone. If you're having symptoms that are persisting, it's always better to be on the cautious side and go to your doctor and be like, hey, I think this is nothing serious, but I want you to know because, right, you're a doctor, he's gone through medical school, that these are the symptoms I'm having. I just want to make sure this is nothing serious, or if this should be worked up. And by worked up, I mean, is there a blood work? Is there something, we can order to see that's causing the symptoms you're describing? And it can be something as small as, I feel lightheaded, and then it goes away. Or it could be like, my vision goes blurry for 2 seconds and then returns to normal. Anything I would say vision related, I would probably go to your doctor soon. Yeah, you don't want to miss a stroke or miss something else that may be going on. So it kind of just depends. I mean, there's no one symptom that I would say that, hey, if you're having the symptom, go to your doctor. Naturally, if you're having chest pain, don't go to your family physician in the office. Go to the emergency department, right? But if you're having, say, a headache, like as I mentioned, and many people get headaches, and you're like, I have a headache, and it goes away with Tylenol, but it's been going on for a month. Something else is also maybe going on, so go to your doctor. Don't wait a month. I would say, like, if you're having symptoms that are persisting for a week, go to your doctor. Make that appointment.
Okay, so what are some of the common illness that you have seen in your practice so far?
We call it our bread and butter. So just the things we spoke about: blood pressure, cholesterol, diabetes. These are problems that I see on a daily basis. I feel very comfortable addressing them, treating patients. Apart from that, not every patient is a controlled diabetic. By controlled diabetic, I mean, they have diabetes, they've been on medication, but their sugars are still very high, and they require, different medications to help control them. So I think that becomes more challenging, that now I have someone who has diabetes and I've started them on a treatment, but that treatment isn't helping. Now I have to do something else to help manage them. And then there will be some patients that, whenever I start working, I'll be taking over from someone, right? They had a different doctor, and now I'm seeing them for the first time, and they may be a diabetic for 30 years. And, diabetes has complications. Diabetes can affect your eyes, it can affect your kidneys, and it can affect your feet. Now, as a family physician, once I know a patient is uncontrolled, I need to make sure that the damage isn't progressing, meaning complications aren't progressing or not developing. So his eyes aren't being affected, making sure his kidneys are okay, making sure his feet are okay. So those are the more sort of common cases that we see. Obviously, we also do a lot of preventative stuff, so vaccinations. We do STD screening, so sexually transmitted diseases, very, very important, especially in the youth, but also in adults. It's a very very good practice to talk to people about it, right? Especially in our community, people don't really talk about that,
Yeah.
but it should be spoken about, right? Mental health, depression, anxiety, like, we have many people who come and, again, in our community, I think it's becoming better. I think more people have started talking about it, but it's still something which people don't realize that this is anxiety or this is depression, or people realize it but don't want to talk about it, and they think that this is how life is lived.
Right.
Right? So these are sort of the cases that that I see.
Let's say if someone is going through mental illness, right, mental health challenges, our initial thought would be to see a counselor, a psychotherapist, psychiatrist. They don't think about family doctor,
Right.
right? Is it something we have to go to family doctor, or like how do you approach mental illness?
Yeah. So mental illness needs to be approached with a lot of care, because when a patient is coming to you, they're coming to you to become more vulnerable. They want to share very intimate things about
Yeah.
why they're feeling this way. And so you can't brush them off. You need to be able to create that environment for them so that they can speak. So the way I like to approach it is to give them that environment, to let them speak, right? Usually the management is what you mentioned. Therapy is extremely underrated. Therapy is fantastic. There are many physicians who go to therapists, right? Like, you would think we have the solution, but we should be able to cure ourselves, but we need therapists sometimes. So therapy is huge for mental health. But there are many people who sometimes benefit from therapy, but they just need that little extra to feel better. And that's where family physicians come in, and we're like, hey, therapy is helping you, but let me also start you on a medication, and let's see how both of them work together. And research shows that therapy and medication together, it's a better combination than one alone. But you always start with therapy. You always start with talking to a therapist, because they have some very insightful advice which you could benefit from.
And I've seen a lot of people go to family doctor to get a referral to those specialists. I want to talk about some being inside me. I wanted to ask the doctor. Every appointment we go to, or anytime we go to hospital, the two questions they ask is smoking and drinking, right? So let's talk about smoking. Is it really that bad?
Yes. No, yes. It's, that's goes without saying. Smoking is just it's just associated with so many bad things and so many poor things. I mean, I don't think it has any benefits. People say that, oh, it helps with stress relief, right? But there are many other things that you could do that actually A, cause stress relief, and B, also help your overall well-being. Exercise, right? Exercise is fantastic. Talking to people, you talk to people, you share your experience, how you're feeling, and you naturally feel better. But yes, smoking is if there's one thing you should stop, and if you are doing it, is smoking. And the earlier you stop, the quicker you will see the benefits of quitting smoking. You start feeling that I can breathe better. You know, and obviously you'll see some athletes, or you see some, shouldn't say professionals, but you'll see, like, people here will be playing soccer or cricket and they're immensely fit and they smoke.
Yeah.
But in the long run, it's affecting you,
Hmm.
right? I haven't even
Yeah.
spoken about things like cancer from
Yeah.
smoking, right?
Yeah. And yeah, that's what I used to wonder. Like, we go to, let's say, liver doctor, they talk about smoking. We go to eye doctor, they talk about smoking. We go
Right.
to dentist, they talk about smoking.
Right.
Every part of the body, we go to the specialist and they ask about smoking. So if it is that bad, and I don't smoke, but I can understand why it's hard to, quit smoking.
Right.
But like you were saying, it is directly related to every illness.
Everything. It's related to blood pressure. It can lead to heart attacks. You name it, and it can be associated with smoking. Look at a cigarette packet. Pick it up. It says smoking is injurious to health, right? Or you see any Bollywood movies, they'll always say smoking is injurious to health.
Yeah.
It's unfortunate. I mean, many people pick up these habits depending on the people they're around, or maybe they pick it up. And, as I said, many people say I started it because I was stressed.
Yeah.
And it actually helps me with stress. And now, the nicotine addiction is there and I can't stop. But there's also ways. There's also ways to help you stop smoking or quit smoking, right? There's medications, there's gums. Some people, if you have the willpower, they say they go cold turkey. They'll be like, you know what, this is my start date. On Monday, I'm going to quit smoking, and that's it. I'm done. And some people manage to do it. They're like, I'm done smoking. But some people require some help, and there is help out there that can help you quit smoking. There's patches, there's gums, there's medication, so anyone out there who is smoking, who understands the consequences of it, but just needs that extra help,
Yeah.
go to your doctor. I promise they can help you.
What about drinking alcohol? Is it bad as smoking?
It's, again, right, this is all moderation, right? Will I say alcohol is great? It has benefits? It's going to help your body, recover or anything? No. But if you tell me, I drink maybe once a week, on the weekends, and that too socially. I'm not drinking to get drunk every weekend, which, a lot of it happens in college, right? You hear all these stories about, oh, it's the weekend, let's drink. So moderation. If you're having a drink here and there, and that too in your limits, like it's not to a point where it's affecting your mental abilities or your cognition. It's okay. It's okay to do. It's not going to negatively impact you. Again, everyone is a little bit different. If you do that for 50 years, right, all of a sudden the negative effects of drinking add up. So yeah, moderation is key.
And next thing that's in the media or the podcast that I'm listening is sugar. People are labeling sugar as really bad, and we don't pay attention to things that include sugar. It's not visible that there is sugar.
Yeah, again, moderation. I think there's guidelines out there, and maybe you can link it to this podcast. But everything you eat or drink, there's daily requirements. And this is research done that this amount is what you require in a day. So I'm not even saying that don't take any sugar. Sometimes that's not good either. But moderation. If you have too much sugar, that can cause problems too. Because then when you're having too much sugar, then again, diabetes, blood pressure, cholesterol, it's a chain effect. Yeah.
All right, so I want to talk about some of the myths or normal things people say. The first thing that people say is, an apple a day keeps a doctor away, So how much truth is in there?
Yeah, we don't keep apples in the clinic or hospital because, it keeps the patients out. No, obviously it's a saying, right? Like it's an apple. It's a healthy snack, especially for kids. In that case, any fruit. So yes, an apple a day keeps the doctor away, sure. But again, anything in excess is not good for you. A lot of fruits, many people say that all I eat is fruit every day, but fruits have a lot of sugar too, right? So again, depending on your medical conditions, everyone's a little bit different. But even having too much fruit, if that's all you eat, that can sometimes increase your sugar levels in your body. Um, but in general, fruits are healthy for you.
Okay. I was talking to someone, and he was also complaining to me that he went to a family doctor and they talked about exercise only. Maybe that was the issue, and doctor was recommending exercise. And then he was saying, I didn't know exercise was that important, where I have to wait 2 months to see the doctor and all we talk about is exercise. What do you think about exercise?
So I think one step before exercise, right? Let's talk about our daily habits. Let's talk about how many steps we get in a day, right? A lot of us have jobs where we wake up, we drive to our office, we're in that office from 9 to 5. We drive back home, we prepare food, we eat, we go to bed. That's it. Where's the physical activity there, right? So if you're not at that level where you're like, hey, I'm going to join Planet Fitness, I'm going to go lift weights, I'm going to do all of these things, because it's hard. Because if you don't know what you're doing at the gym, or you don't know what you're going to be doing, it becomes hard. You waste time there. So one way of addressing or increasing your activity levels is actually trying to become more productive in your daily life, right? So, for example, if you have a 9 to 5, you wake up, you go to the office. There's an elevator. I don't know, maybe not here so much, but many offices have stairs, or they have the option of the lift. Take the stairs, right? Because that's exercise. And then make it a habit. If you have a desk job, every 1 hour, make it a habit. I'm gonna walk. I'm gonna find a path. I'm gonna walk. It might be a 10-minute walk, but if you do it every hour, and at lunchtime you do it for 15 minutes, all of a sudden you've increased your daily activity by an hour, right? This is not even exercise. This is just your daily life, right? You've increased your productivity. You're just like, I'm now walking to all these places, and your step count goes up. That's one small modification you can make to your life, right? And I promise you, you start doing that, and if you have a Apple Watch, or you have your smartwatches, or even your smartphones, and you start counting the steps you take in a day, if you can average 7,000 to 8,000 steps a day, and you can work on your diet a little bit, you'll start seeing your weight go down. You'll start feeling better. And this is even before hitting the gym.
Yeah.
Right?
Yeah.
People say that I don't have time for the gym. Well, do all of these things.
Doctor, tell me about sleep.
Sleep is, yes, very underrated. I think we're in a world now where people want to make money, and money is tied with time, which means sleeping late, waking up early, all that thing. But sleep is extremely important for your health, for your overall well-being. You need to get at least 7 to 8 hours of sleep if you're an adult. If you're a child, those requirements are higher. But sleep is also very important if you are someone who works out, who lifts weights, because essentially muscle recovery happens when you're asleep. And if you're not sleeping properly, muscle recovery isn't happening. Sleep is a very tough topic for some people, right? Because it also, again, it comes down to your lifestyle. I'm sipping a coffee over here, but it's almost 4 p.m. Many people have 3 or 4 cups of coffee, and then they're like, I have difficulty sleeping at night. I can't go to bed before midnight. You might have to cut down on the caffeine, right? Some people have dinner at 10 p.m. because, that's how they've been eating their entire life. They have a late dinner, and then they're like, well, I can't go to bed straight after. So, right, that can affect your sleep. Some people nowadays is screen. Everyone on your phone scrolling, right?
Yeah.
So you need to cut down on the screen time, because screen stimulates your eyes and tells your brain that I want to stay active. So yes, don't compromise on sleep. It's very important.
That's important, and I hope my viewers will pay attention to that, because I have noticed that in my life as well. And I watched this TED Talk, Sleep is Your Superpower TED Talk, and then that was like, wow, it is that important. Like, I never thought, because
Right.
in my 20s or in my teenager, we used to play video games
Right.
whole night FIFA till
Yes.
morning, and then we just go to school or sleep a couple of hours.
Right.
And now I'm in like 30s where like I have to sleep 8 hours.
It's very important, and there will be sometimes a point in your life where yes, your sleep will be affected. For example, uh, uh, newborns when a pregnant woman has just delivered. It's both. Yes, the mother is definitely not sleeping throughout the night. They're not getting, or their sleep is interrupted. But if you're a good father, your sleep is probably interrupted as well, right? Because
Yeah.
you're going to be helping out. So yes, there's points in your life where it's unreasonable to be like, hey, sleep 7 8 hours and you have a newborn, but it's like how? But sleep can also lead to other health conditions as well. Um, we have something called obstructive sleep apnea, meaning that there might be someone who will say that, hey, I slept 7 or 8 hours and I wake up and I'm still exhausted. But then their partner will also say that, but he snores really, really loud. And the snoring is actually because there's an obstruction going on in his airway, which is causing him to snore. And because of the snoring, he's not sleeping well. And that's why, even though he's saying that I'm sleeping 7 to 8 hours, it's not quality sleep at all. So it's actually negatively impacting him.
Oh.
And obstructive sleep apnea can actually lead to weight gain, blood pressure issues, many other things.
Okay. And last time I was talking to one of my friend, he's a breathing coach, and he also talked about that. It's like how important it is to breathe properly,
Yeah.
so that you get a good night's sleep.
Right, right, absolutely. It's breathing is also a great way just to, when you're in bed, you just bring everything down, just relax. It tells your body that I'm ready. I'm in my bed. I want to sleep. So, yeah, breathe. If you have breathing techniques down, it can definitely help you.
What I noticed was in my teenage and in 20s, like I play a lot of sports. I would fall down and I'll get some egg. I'm better next day. I'm good to go. Now I just turned 30,
Right.
and I will play for an 1 hour. Next day I can't walk. I have pain here, pain there, and all my friends are talking about back pain now. Is there something that happens when you turn 30, like physiologically? What changes where everyone's talking about back pain?
It's actually, it's funny. Like, I felt the same way. It's like people say when you're turned 30, like all these, health conditions hit you. But, it really just comes down to what your habits have been related to sports. Do you stretch? Do you stretch before the game? Do you stretch after the game? When you're young, your body kind of responds quicker to these, you respond quicker, right? It doesn't affect you as much. You're lighter, right? And so your body is able to adapt and get you back working. As you age, you're because of your posture, because of many other factors, your muscles become tense. You develop stress. Your muscles become tense. You sit, so your leg muscles become tense. And all of a sudden, you want to go play like you were 15 or 20, and you'll pull a muscle,
Yeah.
right? So that what's happened. I think that's what it is. Like, by the age of 30, you develop these habits that are normal part of adult life. Working as a kid, you're not working, you're staying active, so your muscles are in that way becoming stronger. But after you've started working, you tend to shift more towards work and less towards physical activity.
Right. You're
Yeah.
sitting more.
Exactly.
You're traveling more.
Yeah, so I think that's what's really the issue.
Let's say I want to be a grandpa and still be able to play with my grandkids, right? I'm 60 plus, but I'm still able to, play with my kids. Hopefully no medications.
Yeah.
Hopefully no addictions. What are some of the lifestyle changes or habit that I have to start making from 30 now?
Staying active, as I said, if gym right now is a struggle for you, get a watch, get something that can track the number of steps you take in a day, and try to set a goal for yourself that, what, for a week I'm going to do 7,000. Once you reach 7,000, be like, for a week I'm going to do 8,000. It becomes a little bit harder in the winter, but walk around your house, or if you go to work, try to see in the office space if you can walk somewhere, or if you have your lunch break, take 30 minutes. walk. So being active is extremely important. You'll see a lot of, South Asian parents or elderly people where they're like, oh, I'm old now, I can't walk, like that's it, like if I walk too much it hurts. But it's really because you're deconditioned. And so staying active is probably one of the most important things you can do. Secondly, yes, take a look at your diet. I'm not saying that you should be trying to lose weight, but a lot of the times, after lunch you see many people go sleep. And it's because you've had too much food, right?
Yeah.
So be mindful. What are you eating? And thirdly, which is slowly becoming more popular, and many people are learning about it, is actually resistance training, which means training with weights, not just cardio, not just running or walking, but lifting weights. Why, you might think, is it important in the elderly? So in the elderly, what we're concerned about is falls, right? Because you age, your bones become weaker, you fall, you develop a fracture, you fall, you break your hip. These are some things which we do not want at all. And the way to tackle that is to build stronger muscles. As you age, your muscles do become weaker, they become deconditioned. And that's where weight training comes in handy. I'm not saying become a bodybuilder, but I'm saying do weights. Find either a gym trainer, find many physical therapists who can tell you what exercises are good to help you with balance. And muscle building is a key component to it. So those three things: staying active, so continue your walking, watch what you're eating, and then lastly, implement resistance training to help with your balance.
At least lift something.
Yeah.
Okay. One thing that just popped in my head is whenever we get sick at home and we don't want to go to see the doctor, usually parents will be like, here is ginger tea, or here's the honey. These are like some medication at home.
Yeah.
So does homemade medication works?
So it's for me, it's symptomatic relief. Now there's another field of for your health called naturopathic, which they may know a little bit more about herbal medicines than I do.
Yeah.
But in general, the things that you mentioned, they were, those are great if you have like a runny nose, if it's viral symptoms, right? Those things are great. Like, they help make you feel better. It's called conservative management.
Okay.
I don't see any harm in it, but obviously talk to your doctor, talk to your physician. If you can't get to them, in general, I don't see these treatments being harmful.
Okay. It's not actually treating, but it's just managing the symptoms.
It's conservative, yeah. It's making you feel better, and yes, they have, like honey and ginger, as you mentioned, have components that help fight viruses and bacteria, and in general is good for your body. So there's no harm in taking them. Actually, many people who have cough, you hear like, I'm having a cough, I'm gonna go get cough syrup. I don't prescribe cough syrup. Honey is actually proven to be just as good as cough syrup.
Okay.
So what I advise patients is take honey, take it with milk, take it with water, and it helps soothe the throat, and it actually has many positive effects to the body, rather than taking a medication that probably makes you a little bit drowsy and doesn't do too much for your cough. Yeah.
Wow.
So yeah, I like honey.
Yeah, nice. Yeah, well, I like honey too. I bring it all the time. Okay, so many questions that I ask.
This is fun.
Yeah. So in your practice, so you see hundreds of patients per day, and then you go your home, right? How do you detach from that?
Yeah, so that's a very good question you've brought up. Physicians talk about it a lot. We call it burnout, right? Everyone has burnout. There's different types of burnout. Physicians burnout too. And it's something that I'm also trying to learn. I was very bad at it during residency. I used to oftentimes bring the work home, meaning I finished seeing patients, I finished my documentation, but now I'm thinking about every single patient that I saw and what could I have done better, what did I do wrong, which it's a great trait to have, but it's mentally draining, right? You can't just bring it home. and you need to have something that just distracts you from that work life, right? Because all you think about is work, it's going to mentally drain you. So yeah, it's a work in progress. I think easier said than done, because what comes with burnout is then mistakes. Eventually, you reach a stage where you're so burnt out that you miss something that a patient told you, which is extremely important, right? So it's something that I'm working on. I hope it gets better, and it will get better. I think I have to do it. But yeah, it just takes time.
Yeah, I feel like if anyone who will get burned out is doctors, right? Oh my God, like they are seeing the worst thing. They're actually showing empathy. They're making people believe that they're gonna feel better, and at the end, like it's all on you.
Yeah, I mean, don't get me wrong. Yes, physicians have it, and it comes from a good place when you're trying to address every single little thing, right?
Yeah.
Like that's what patients want. They want you to listen to them, and you're trying to do it, but in the end, you're burning out. But many jobs have it. It can happen in family, right? Like say you have someone in your family that you're taking care of. That can lead to burnout too,
Right.
right? Because all you do is take care of them. So it happens everywhere. But I think in the last couple of years, physician burnout has come into the news.
Yeah, yeah. Doctor, is there anything that I didn't ask you that you wanted to talk about?
No, I think you've touched upon some really good topics. I think the one thing I would like to tell everyone is, don't be shy. If there's anything going on in your head that you feel that, other people may laugh at, so I don't want to bring it up to your doctor. There's a doctor-patient confidentiality. What you tell the doctor, no one else needs to know, including your own partner. So say you're a wife or a husband and you come into the doctor's office and you want to share something with the doctor, but you don't want your wife to know. Your wife will not know. It's doctor-patient confidentiality. And, it's might be a small thing, it might be a big thing, but always bring it up to the attention of your doctor. And just from a mental health standpoint, there might be someone out there who has developed anxiety, who has developed symptoms of depression. Reach out. Your doctor can help you. And if not the doctor, he can definitely direct you to someone who can. Naturally, if you don't have the support, your family doctor will always be there for you.
Yeah, I can relate to that. I remember when I was new in Canada, and the doctor will do the physical checkup, and when it came to the private parts, I would kind of hesitate. I would not give a consent.
Right.
I'll say no, I'm good. Later on, I realized that is necessary. Like,
Right.
what if there is something wrong that I don't know? The doctor is someone I should be trusting.
Right.
So, like you said, the confidentiality is there, and the trust is biggest thing, because at the end,
Right.
doctors are for your health.
Exactly. And that's where the first couple of visits with your family doctor becomes important, because if I don't make you feel comfortable, you're not going to share what's bothering you with me, right? If I come in and be like, okay, what's wrong? Okay, one complaint, that's it. Why should the patient share other things with you? So
Yeah.
I think that's where, from a physician standpoint, we need to be a little bit more understanding in those situations at times, to create that environment so the patient can open up and tell us what's going on.
Yeah. It was a lot of fun. Like I said, I had so many questions. Like, it's like I don't have to go to doctor office. It's like meeting a doctor in front of me, and all my questions that I got to ask you. How do you see this experience? How did you feel?
No, I think this is a great initiative you've done, Sudesh. I think it's fantastic what you're doing for the Nepali community here in Ottawa. I told you I didn't realize there were so many Nepali people here, but I think having people like myself who can speak about medicine, because that's my specialty. But yeah, I've seen you've had other people. You've had Faizan on, who's spoke a little bit about cricket, which I'm a huge supporter of any sport that you play. I think it teaches you a lot. So, this experience has been fantastic. I think this is a great initiative, and I wish your podcast goes on for many years and your subscribers go even higher.
Thank you very much, and hopefully in future we can get this opportunity again, because right now we just talked about every aspect of our health lifestyle, but I also want to talk about a lot of diseases specifically, and I feel like it will be a great learning for our viewers, right? Um, and that's my goal, is that if you watch my episode, you at least learn something. So
Yeah.
having a professional like you and be present on my show, it's a
More than
huge
happy.
privilege for me.
No, not at all. More than happy. I would love to have a part 2 of this podcast.
Perfect. Thank you very much.
Thanks,
Doctor.
Sudesh.
Thank you. Okay. Thank you so much for watching this episode till the end. I really appreciate it. If you haven't, please subscribe me on YouTube. You can find me on Guff-Gaaf Unfiltered with Sudesh Gurung. If you're in social media, you can follow us on TikTok and Instagram on Guff-Gaaf Unfiltered. If you have guest recommendation or you want to be on my podcast, please message me. Please let me know how I can improve this podcast, and keep supporting so I can bring guests from different areas, different professions, and they can enlighten our episodes with their insight and experience. Thank you once again.